Hi, my name is Connie McLinus and you're watching the video on divergence exercises. When do we prescribe divergence exercises? This is for patients who have an ESO deviation and poor control of the ESO deviation. So now we're looking at patients with a decompensating esophoria or an intermittent esotropia. We also prescribe divergence exercises post-convergence training. So in the previous video, we have discussed how we can exercise convergence. Now, if you're asking your patient to undertake a convergence exercise 2 or 3 times a day for several weeks at a time, then what can happen is a spasm of convergence. And so at the end of a convergence exercise, you should give a relaxing exercise to give the opportunity to the patient to relax their convergence. So here we have a list of the various type of divergence exercises. The first list are relaxing exercises, which are the type of exercises that are good for patients post-convergence training. So say we've given a patient simple convergence exercises. Each time they perform those simple convergence exercises, they should follow it with a divergence or relaxing exercise. Framing is the simplest, which is basically looking into the distance whilst having a target at near that you appreciate with physiological diplopia. Another exercise we can do is bar reading to improve the maintenance of BSV and specifically to learn to accommodate without over-convergence. This is particularly useful for patients with accommodative esotropias. And what we're doing with bar reading is essentially the patient is looking at text whilst holding a bar in front of the text. Now, in order for them to be able to read the text, they need to maintain BSV and have physiological diplopia of the bar. If they over-converge, they'll end up with an esotropia and suppression, and the bar will actually interrupt their view of the text, so they can't read. So in order to be able to read, the patient needs to have BSV or maintain BSV and appreciate physiological diplopia. Other exercises to improve the control of the deviation include improving fusional divergence and improving relative fusional divergences, or specifically negative relative fusional divergences. Okay, in terms of improving fusional divergence, again, we'll give the patient base in prisms. So we'll give them a prism bar, ask them to exercise the base in fusion range and try and build that to improve control of the ESO deviation. In terms of relative fusional divergences, we can use stereograms or diploscope. Again, the stereogram is the most commonly prescribed exercise. And the difference in the way in which we prescribe the exercises for ESO deviations as compared to exo deviations is that for the ESO deviations, we're going to perform this in stare-through. So the patient's target will be out here behind the stereogram, in which case what will happen is their vergence will be behind their accommodation. So again, they'll need to see these cats clearly in order for you to be exercising relative fusional divergences. Okay, that brings us to the conclusion of this video. Thank you for watching.